Welcome to the Healing Our Sight podcast. I'm your host, Denise Allen, and I have with me today Dr. Joanna Carter. She is an optometrist with an emphasis in vision therapy and neurorehabilitation. And since opening Insight Vision Therapy in 2016, she's lectured in over 50 locations locally, nationally, and internationally. In 2017, Dr. Carter founded VTODs on Facebook, a group of optometrists and vision therapists to discuss cases and treatments related to vision therapy. Dr. Carter lives in Southern Oregon with her husband and 3 teenage children. She enjoys traveling, playing games, and learning about health and wellness. So, welcome, Joanna.
Thank you for having me.
I'm so happy to be able to share all your expertise today on this episode. How is it that you decided to become a developmental optometrist?
So I was interested in everything in optometry school. I remember thinking like, man, I could specialize in contact lenses or eye disease or vision therapy. Like everything was interesting.
Mhm.
And when I was doing my internships in my fourth year, um, for 1 3-month period, I spent 1 day a week at a vision therapy clinic, Lifetime Eye Care in Eugene, Oregon. And those 12 days completely changed my life. I was like, I would spend my day in the vision therapy room. Never did an eye exam in that clinic. And I watched lives transform.
Wow.
I wasn't watching vision necessarily changing. It wasn't like, oh, look at how they can move their eyes better. It was, look at how they have more control, more confidence, more their like personality changes. Like I was blown away. This was not what I had learned in school. Like use this device and you're going to do this with the eyes. So that I hook, line, and sinker, I was in. So that was what made the decision for me.
Nice. I love it. And when you started out, were you just doing vision therapy from the very beginning, or were you kind of doing everything?
My road was a little bit, let's say, non-traditional. When I started out, I knew I wanted to move to Southern Oregon, and options were limited in terms of where I could work. So I worked part-time at a private practice where I started diving into the vision therapy, and I worked part-time at a Sears Optical. Um, and so I did that for 2 years and started seeing vision therapy patients. And then at the 2 year mark, I had my first child and decided that I really needed to dedicate my time as a mom. So I actually stopped working at the vision therapy practice, which was one of the hardest decisions I've ever had to make, um, and just worked at Sears Optical a couple days a week for years while making babies and raising little babies. So that was really my emphasis. And then once my littlest one was a couple years old, got back into a primary care office, again started diving in, like re-diving into vision therapy. At that point, I was like, I have to dust off these cobwebs in my brain. How do you even do this stuff? It'd been so long.
Yeah.
Um, and then I actually got to the point of hiring and training a vision therapist and really like I realized that was my great love,
Mhm.
and came to kind of a tipping point where a decision had to be made. Like, what is the rest of my career going to look like? And I was at a vision therapy conference and talking to a friend of mine. I was going, I'm not sure what to do in this situation. And she said, well, you just need to open up your own office. And I said, I can't because I have these young children at home and they are my top priority. Um, and so there's no way that I can run a business. And my friend Brenda Monicalvo said, yes, you can. And this is how you're going to do it. And within a few minutes time, she had like the process laid out of how I was going to make it work, how I was going to prioritize my time. And she said, you're the specialist. They'll come to you. You make the hours that work for you. And that really resonated with me. And so within 4 months later, I opened my office.
Wow.
So it was a pretty quick turnaround. And yeah, we're going on, I think, yes, it'll be our 8 year anniversary next month. So in at my current office, Insight Vision Therapy, that's essentially all we do. is vision therapy and neurorehabilitation, and treating patients with strabismus and amblyopia, like, poor vision in one eye or eye turn. Um, and everything else I can refer out for. If
Okay.
somebody comes in and I'm like, I'm still going to look, right? So you always have to look like, oh, your optic nerves look concerning. I don't want to treat that. Go see this person, right? So
Yeah.
that's kind of how I do it.
Nice. I love that you had a mentor pushing you into that and that it worked so quickly. As so
Yes, obviously that was exactly what I needed to hear at just the right time. I remember going home and telling my husband, "So we need to talk. I have some big plans." He said, "Why don't you wait a month?" And I'm like, "I can't wait a month. I'll wait a week." And a week later, I came back to him with my business plan and all this stuff. I was like, "Okay, so this is what we're doing. This is what I'm doing." So
That's awesome. So you indicated when we were talking that your office sees a lot of brain injury patients.
yes.
And is that because patients refer people, or you've got doctors in the area that are referring TBI patients, or how's that all happening?
Yes, it's mostly because of referrals from other providers.
Okay.
That I would say, yeah, that's where the majority of those patients come from. And it's been really, it hasn't been from any sort of advertising that I'm doing. It's mostly been just getting out there and um, sharing what I do with different providers. So I've done like educational seminars locally at different offices so that people can get to know what we do and how we work differently than, for example, occupational therapy and physical therapy,
Mhm.
vestibular, rehabilitation. So I've gone to the hospitals and I've gone to the sports medicine clinic. That's a big one where we get a lot of referrals from. And then other than that, I send what I think is a really great report um, to to the primary care doctors as well. Each time I see one of these patients, I will
Mhm.
send the report back to whoever referred and then also to the primary care physician because in my opinion, we should all be working together and they should know what's going on. Um, so I think that too has for the doctors that do like look at the reports and read them,
Mhm.
it's been really helpful because I've had some doctors be super advocates of mine that I've never even met before,
Oh
which is
yeah.
kind of a cool experience.
Yeah.
And I would
Because
say the other place that I
because the
get a lot of,
report, sorry, and so the report's showing the difference in the patient from when they came to you versus after the treatment, right? And
so
then the
it's doing
doctors.
both. Yeah, sorry. The initial report is just a description of what's going on. I take a crazy detailed history. I fortunately can type fast, so while they're describing everything to me, I'm just jotting everything down. And then when I kind of I think the meat of my report is in like my plan of care because I describe what each diagnosis is and how it relates to the brain injury. So, for
Mhm.
example, one of the things that we commonly see with brain injury is difficulty te teaming the eyes together, like allowing the eyes to move inward to look up close, for example.
Mhm.
And so, if the brain is having a real hard time with that, then reading is going to be fatiguing and computer work is going to be terrible. And, we're going to be very symptomatic because the brain is really struggling to aim the eyes inward.
Mhm.
So, that condition called convergence insufficiency, I will describe it and say, this is what this condition is, and this is how it relates to the brain injury and their symptoms, and this is what we're going to do about it. So
Mhm.
I think that is helpful. Again, if they read it, they have the opportunity to learn what's going on and how all of this is connected. And then the follow-up reports will show what the improvements are
Mhm.
and if there's still more work to be done or if they're finished with the program or what.
Okay. It's that's a great way to advocate for this type of treatment because I don't think that doctors are aware that it's available and that it's needed for their patient.
Right. Right. So I think that has been helpful. Also, unfortunately, a lot of these patients are involved in kind of medical legal like um, oftentimes my patients are coming in following a car accident, so there may be legal issues, illegal entities involved with that, and that's another thing that I think my reports are helpful because it shows what's going on, and um, so it's just helpful to really help people understand.
Yeah. And I guess I wasn't aware that a brain injury is going to cause the convergence insufficiency as well. Because can some of these people already have had convergence insufficiency before the brain injury too?
Great question. What my take on it is that the brain, when it's injured, it likes to take things that maybe were a little bit hard and
Mm.
make them bigger,
Okay.
right?
Hmm.
So may have had just maybe like manageable convergence insufficiency, like not symptomatic, and then we get hit on the head, and now we can't move our eyes inward to save our lives.
Okay.
We may have a little bit of anxiety, and then we get a brain injury, and then we have unmanageable anxiety.
Hmm.
So that's what I see. We may have
Okay.
had just like maybe an intermittent eye turn, and then we have a brain injury, and now we have a constant eye turn. So I
Mm.
just see like a magnification of issues oftentimes. And sometimes we have things, I mean, not everybody gets an eye exam by a doctor that looks for how the eyes move inward. So they
Uh-huh.
may have had, there may be no data to show whether they had an issue prior or not,
Mhm.
but we see it afterwards for sure.
Yeah.
And the like the research and the studies do show a massive increase in convergence insufficiency, much higher numbers of CI, as we call it, following brain injury than what you see in the general population.
Okay. That is so fascinating. I have a friend who is in vision therapy right now who had a brain injury.
Hmm.
And she says that caused strabismus for me. And I was like,
Hmm.
did it really? But what you're saying makes so much sense because maybe she had the tendency towards it before the injury, and now she really has the strabismus and has to deal with it.
Yes, and I did have that speaks to a patient of mine that I saw several years ago who he presented with an eye turn when he was looking up close after an injury at work. And I said, well, in my brain, I was thinking we don't just develop an eye turn after a brain injury. So I was going on the mindset that he always must have had an intermittent eye turn, and now it's more consistent. That's what I was thinking.
Yeah.
And then unfortunately, COVID hit and like lots of time went by. I actually then later got his previous exam records from a doctor who did that kind of testing, who actually did look at that.
Uh-huh.
And indeed, he did not have an eye turn prior to the injury.
Okay.
And so that for me was just like, whoa, okay, now we have a really legit case
Yeah.
because, if well, the attorneys love to go, well, if they already had it, then, the
Mhm.
brain injury didn't actually do anything. But in this case, he went from no eye turn to eye turn. And that is significant.
Yeah. So it could have caused the strabismus for sure then. In for my
Right. Now,
yeah.
this patient's eyes had a tendency to kind of posture or aim a little further away from the target, like looking a little further outward, but both eyes were still working together before the injury.
Yeah.
And then so that the injury caused that disconnect,
Mhm.
which we were able to rehabilitate back to about his starting point, which was both eyes aiming together again. So, obviously, we're pleased to be able to help in that way.
Right. Yeah. That's so fascinating. I think there's just so much we don't understand about how our vision works and what a brain injury will do to us, right?
Right.
Yeah, and you also experienced a brain injury, right?
I did. I like
Yeah.
to say I had the opportunity to experience a brain injury, which that was, I remember laying in bed after my concussion in 2015, thinking, I'm going to learn something really valuable from this. This is my takeaway.
Yeah. Okay, so that was before you opened your own office.
That's right. So I was
Mhm.
already seeing brain injured patients. I mean, I just recently started diving into the neuro rehab side of things with the vision therapy. And then yeah, it was a spring day in 2015 and was at a park with my son and bent down to dust him off and stood up quickly, not realizing there was like a platform right above my head
Oh, yeah.
and just bam, just slammed my head right into that platform, crumpled to the ground, laid there for a bit. Um, and then we went to my daughter's kindergarten graduation and I cried,
Oh,
not because I was an emotional mom, but because I was so disrupted. Like
mhm.
my system was so dysregulated and ultimately went to urgent care, taught that physician how to check my eye movements. Um, and and then, we determined that likely had a concussion and no other scans or anything were needed. But I was in bed for a full week. I
Oh,
just could not function. I would wake up and try to move and I would be exhausted and I would have to go back to bed. And that was just my cycle for a solid week.
mm,
Um, Eventually I went and contacted a provider that I knew did craniosacral therapy.
mhm.
Um, and totally changed the trajectory. I went from essentially non-functional in bed all day to being able to return to work, being able to be out where people were moving and
Uh-huh.
talking, and not being as overwhelmed. So that really started that process of recovery for me, which was good.
Yeah.
And yeah, but I learned a lot in that experience.
Sure.
Because even when I returned back to work, the first thing I realized was like I couldn't look at a computer screen. So that first day back at work, I was scheduled to see therapy patients. I was in the process of training my brand new first ever vision therapist at the time. And I remember going to chart something and looking at the computer. And then I said, Nate, today you learn how to chart because I couldn't do it. Uh, so just, that was an interesting experience. That improved pretty quickly. I think my biggest takeaway from that concussion, though, was the impact that it had on my mental health. Because I am not somebody that really is prone to anxiety, depression, that kind of stuff. I'm fortunate, blessed to have not really struggled with that in my life.
Mhm.
Um, but whoa, did I experience some of that in that time frame. There was one day where I went into work and one of my staff members was parked in the spot that I usually park in. Now, my name's not on that parking spot. It is not designated as mine. And my brain immediately went to, oh, they're trying to get rid of me. They're trying,
Oh,
like, I might as well just quit my job and try to find another place to work. And then my other brain was like, hold up, what? But just thoughts like that, where I would just go from like thought to like spiral in like instantly.
mm,
And I felt like somebody else was living in my body. Like it wasn't even me. It was so uncomfortable.
wow.
But I didn't know why. Like, why is this happening? What's going on? So, um, I wound up talking to a different mentor of mine saying, I'm trying to figure out, Gabby, what's going on? Why is this happening? And she said, Joanna, you had a brain injury. This is really typical. And I'm like, oh, Oh, like I knew that, like in my head, I knew that I had learned that, but to really experience it was something else.
Wow.
So, for me, once I recognized, oh, okay, this is brain injury doing this to me. At that point, I would then say, like, when these thoughts would enter my head, which still happened pretty frequently for like the next couple weeks, I would like thought would come in and I would think to myself, Joanna, what would a normal grown up do in this situation?
Wow.
And then kind of help to talk myself through it. And
Mhm.
that completely changed me. Just taking that pause to go, let's breathe and think this through before we just jump in and, react. And within a couple weeks, I had made significant progress. I did not see a mental health provider or anything like that because I was able to make that transition on my own. But I'm going to say, not everybody is so fortunate in that case. And so just having that firsthand experience helps me to know to, number one, ask my patients how they're doing in that realm because people are really good at like trying to fake it. So I do try to just check in especially when I'm seeing them for the first time. How are you doing in that realm? And if there's any sort of hesitation or anything, then, we're talking about what are some options that they may have to address that. Because I
Mhm.
think it's so important because that can really impact your timeline of recovery if that's not being addressed.
Okay. Yeah, that's awesome. I think people are not really aware that there's so many facets to a brain injury that they need to think about.
Right.
Yeah, that it's not just, "Oh, I have a bump on my head and it's gonna get better and it's gonna be fine." It's doesn't happen that way. Um,
I cannot count how many people have broke down crying, not realizing that just like I didn't realize, and I'm the professional, but when it's yourself, you know, just not putting the two and two together, just feeling like, well, I just don't know why. I'm just not me,
yeah,
and so it's really important.
yeah. So do you have a process for determining what kinds of therapy people need when they present at your office with a brain injury?
Um, sort of.
Okay.
I was just telling someone the other day, I was like, it's kind of like, you remember those old choose your own adventure books? Um, so I sort of feel like I'm playing a choose your own adventure game in my brain when I'm hearing the patient's story,
Okay.
because what I am trying to do is try to figure out which path will help us make the most progress in the shortest amount of time. That's my thought process in this. So I'm listening for certain key words or key symptoms that may direct me toward one treatment or the other.
Mhm.
For example, if somebody is presenting with symptoms of dizziness, motion sensitivity, balance problems, then I'm going to be looking specifically at something with their lenses, their glasses that
Mhm.
I may change or add to help dampen those symptoms and reduce those symptoms. Sometimes it's adding prism to the glasses to change their awareness of where their center is, which sounds really weird, but a brain injury can kind of knock that offline
Mhm.
where you feel like your middle is maybe over like aligned with your left eye. And if
Mhm.
you feel like your middle is shifted off center, then you are going to be like shifting your balance accordingly
Mhm.
in a way that makes you fall over.
Yeah.
And it like, why would your brain do that? I don't know why your brain would do that. But that can happen. And so if I'm watching the patient and if they're like leaning to one side as they're walking down the hall, or if they're telling me I'm falling over a lot, do you always fall in one direction? And they go, yeah, I'm always falling to the wherever. That's going to help guide me in terms of, aha, okay, I can probably dramatically impact this patient by it changing their lenses. Also moving them from maybe a progressive lens, a no line bifocal, which requires a lot. of visual processing
Mhm.
because your vision is different in every single different part of the lens. Um, so that can be visually overwhelming for someone who's had a fresh brain injury. So I may move them temporarily out of their progressives and into just single vision lenses where it's one power throughout. So a lot easier for the brain to process. So
Mhm.
that's choose your own adventure one. If they're presenting with more of like just dysregulation, and what I mean by that is like they're tired, they have maybe double vision, like extreme light sensitivity, um, those kind of some symptoms. I may dive into Syntonics light therapy first to help balance their nervous system and just to kind of bring that level of sensory overwhelm down. Um, I have had the opportunity to have actually two concussions, and the second one was a few years after the first. And at that point, I was then doing Syntonics, and I did find significant relief in my sensory overwhelm with a short-term Syntonics treatment.
Okay.
And then finally, I will often try do one of those two options first. And if they're, maybe they're 50% better, but not all the way there, for me, that's usually when we're going to dive into the in-office vision therapy to
Mhm.
do the more active rehabilitation. Um, but I like to give these other tools the opportunity to kind of do their job first because many of my patients, once we give them those tools, their brain is so happy and then they don't need the in-office rehabilitation. So that's my choose your own adventure game.
Nice. And you mentioned that you did cranial sacral therapy. Do you refer people out for that too?
Beautiful segue. So that is very frequently also on my list, especially if the patients are having chronic headaches that are localized to like one spot. Then for me, that is like kind of a jammed system. Um, like the cranial bones should actually have some freedom of movement. We think of our skull as fused, but there is a little bit of give in between the plates of the skull.
Mhm.
And if those plates are jammed together because of some sort of trauma, that's going to cause a lot of symptoms. And so that would be one reason why I would refer for craniosacral. Also, and very importantly, if they're having neck issues, because the neck is like that pipeline for all the information that's going up into the head, including visual system. So if my patients are having eye movement issues or chronic dizziness and neck pain, restriction of movement, that neck has to be addressed, or else I will hit a wall in my progress.
Mhm.
And I don't like hitting walls. So I want to address those things as fast as we can so the
Sure.
patients get better.
Yeah. So that gets addressed with cranial sacral, or do you also do referrals to chiropractors and that kind of thing too? Or
I have a personal bias towards most gentle things
Mhm.
first.
Yes.
So I personally recommend or refer for craniosacral
Mhm.
first.
Okay. I like that. I don't know a cranial sacral therapist near me, so that's not something I've ever actually tried. But I did find a very gentle chiropractor, and he's going to be my next guest actually, so that's going to be fun. Uh,
Wonderful.
yeah. What would the typical timeline be for a patient, or is it still your own adventure? It's all going to vary.
Yeah, that's the thing. In that to answer that question, I feel like I need to quote my friend Kurt Backstrom and say it depends, um, and it really does.
Yeah.
It does depend on several factors, um, but every brain is so different
Mhm.
that it's hard to even anticipate. I have had some patients that are wildly symptomatic, and maybe even it's been years since their injury, and you do a little bit and it changes a ton.
Mhm.
Like, and then I've had other patients that just take the slowest road to recovery. So I would say, it can take weeks to years.
Okay.
And hopefully, if, my mantra is kind of like, okay, we don't want to be doing what's not working, right? So if we're doing the work and nothing's changing, then we have to take a different approach. And now my joy is when we're working with patients and they get better, right? But once in a while, it doesn't happen. And then I'm racking my brain to figure out who I refer to, because we've got to address there's something deeper then. There's something else that we must do in order to help this patient to get to that finish line, right? So, yeah, it's super variable.
Okay. Do you think mindset has something to do with the timeline? I'm just curious.
I think probably, yeah. I mean, I certainly think so. Um, but I feel like I, I, I have the very, very rare patient that isn't highly motivated
Okay.
to get better.
Mhm.
But it is hard when you have been struggling for a really long time. And in general, I am not even close to the top of the list of providers that the patients see, right?
Mhm.
So typically, I am the fifth to eighth provider that the patients have seen, and sometimes they're feeling pretty defeated by the time they even come in. And I've
Yeah.
had people, even someone recently, who walked in the door and looked at my equipment and said, "Another eye doctor? Why
Mm.
am I even here?" And I assessed the situation and, told them what I thought was going on. And they're like, "No one has told me that." Like,
Mhm.
and that's why you're here.
Right.
But so it can be hard because we just a lot of times, if the visual system has been holding the patient back, then they could have been doing physical therapy, vestibular therapy, occupational therapy, like all these treatments, chiropractor, and yet there's just this real slow progress. So sometimes we do just really need to tap into vision for that big leap forward to happen.
Right. So, how could we shorten that timeline for them finding you? You know,
That's a
that's
great question.
because there's a problem in knowing that it's even gonna help, right? The first person that they're gonna go see is gonna be those other people that you talked about, right? Because
Right.
they know about them.
Correct. Yes. And I think, I mean, in general, the doctors that are associated with hospitals, who are a lot of times where people will go when they have a brain injury, they're going to refer first to their rehab team, right? Because that's their people.
Mhm.
And so oftentimes I'm getting the people that have attempted some sort of neuro rehabilitation, and their brains have revolted because a lot of times um, one of the first line things that the patients are asked to do is to look at a target that they are holding in their hand, so at near distance, and
Mhm.
move their head side to side. Well,
Ooh.
if it is hard to aim your eyes inward, that's step one. If step one is hard, then trying to move while also doing that is almost vomit worthy. Like they will get physically ill.
Mhm.
Um, and then at that point, typically the physical therapist goes, "I think we need a referral to Joanna." So, but that being said, there are many, many patients that do just get better with those traditional, therapy techniques. So at least in my area, that's usually the path that is taken, is that they will go first to the other rehabilitation, and then if they're hitting a wall, then they come and see me. Hopefully that doesn't take too long, but sometimes they're just not managed well. Maybe they're seeing a doctor that doesn't have as much experience, and so is telling them just keep resting, just keep waiting. I think that there is something to say for just giving your body the opportunity to settle down, nervous system settle down. Um, but we also need to add in some gentle activity at the beginning of that rehabilitation process as our bodies let us. And if our body's not letting us, then we need to seek treatment right away. So that's the thing, is just jumping into that active therapy. Um, it needs to happen within the first few weeks if we're not noticing fast improvement.
Okay. So you mentioned some of the symptoms before when you were talking about the two different trajectories that you
Right.
kind of see. Is there like a little checklist that people should have if they have a brain injury and they go, okay, I'm experiencing this and this and this and this, and so this means I need to go see someone like you who is going to address it with some kind of vision therapy?
Um, well, yeah, I mean, certainly. We in my office we have a brochure that lists this different symptoms that are commonly seen with a brain injury, and some of the symptoms may not appear to be vision related, but they are.
Okay.
Um, so, not everybody thinks headaches has to do with vision. But again, if your brain's having a hard time aiming those eyes inward and you are on your phone, so you requiring your eyes to aim inward, then
Yeah.
your options are either I look at my phone and get a headache, or I never look at my phone. Well, a lot of us are going to choose that headache. You know what I mean?
Uh-huh.
Because we got to stay connected, right?
Yeah.
We got to do some work. We got to do some things up close, and so a lot of times headaches are related to the visual system, and so that certainly needs to be addressed. Certainly, anything where our vision is fluctuating, blurring in and out, doubling uh, double vision is definitely a vision problem. So, but it might be kind of a weird doubling where it almost looks like it blurs and comes back together. And some people interpret that as just blurry vision, but it's really that the eyes are having a hard time aiming together. So those are clearly visual. But then there are some things that may not seem so visual, but are still rooted in the visual system, like dizziness, motion sensitivity, light sensitivity, difficulty with fluorescent lights, like feeling like those are going to kill your brain, um, real hard time processing or just being overwhelmed in crowds,
Mhm.
grocery stores, they're the worst. Um, and that because your brain's trying to take in all this visual data
Okay.
and motion and people and too much and usually fluorescence. It's
Yeah.
all the things in one place and it's too much. And then any issues regarding reading. I'm having difficulty remembering what I'm reading. I can't track across a sentence. I'm skipping lines. I'm losing my place. I'm mixing up words. Um, anything related to that, and that usually is because the eyes aren't tracking well. And when I say tracking, I mean like how they move together as they move across the page. If they're going too far or not far enough, then where they're anticipating, then things are going to get jumbled and mixed around.
Yeah. And some of those people would think, okay, that is a vision issue. But I was thinking about the fact that if you're in a grocery store, you're not necessarily thinking, oh, this is a visual issue, that I feel anxious while I'm here and that it feels overwhelming. And then the anxiety is more what you're focused on as being the symptom rather than it's a visual issue.
100%. Yeah. And in fact, I've seen that before. I had a patient who I've lectured about, but she was diagnosed with, I forgot what the term was, like psychogenic anxiety. I don't know, something that sounded really scary. And they essentially said, this is the type of anxiety that there is no treatment for.
No.
And that's what she was left with, right? So she came to me because she said, I just don't understand because I can't, it's movement.
Mhm.
I can't process the movement. So it's got to be with my eyes, right? And indeed, she had a small vertical misalignment of her eyes, where one eye aimed a little higher than the other. She also had a difference in lens prescription between the two eyes that was just enough to make that processing of movement different from one channel versus the other.
Mhm.
And that was enough to make her brain really unhappy when she was on the freeway.
Mhm.
Um, so we wound up prescribing some specialty lenses that completely changed her life.
Yeah.
And turns out it probably there may have been a combination between the two. I think the vision was certainly contributing to the anxiety, but it was not anxiety all by itself.
Yeah. There's always a reason we feel anxious. And I
Right.
think that we need to address that first rather than call it an anxiety issue.
100%.
Okay. This is so fascinating. So, are there some things that people can do on their own if they've experienced a brain injury, or should they just seek help? Or I
Well,
guess that's not a great question. They probably
right.
need to do both.
Right. When in doubt, I'm never going to say, well, don't go seek medical advice. Right. I mean, like, "Oh, okay.
Yeah.
Obviously we want to rule out the big things and make sure that everything's okay in that realm if there's a concern in that regard. Like, if you bumped your head and you have zero symptoms related and you feel perfectly fine, do you need to go see somebody? Okay, well, probably not. Like over the weekend, we were posing for this cute picture with my family, all huddled together, and my daughter was right in front of me and came up and smacked her head into my head, and I was like, "Woo!" Yeah, but I was okay. Okay, I'm like, assess the situation. All right, we're good. Awesome. No symptoms. Uh, but yes, if you are feeling nauseous, lightheaded, vision issues, that kind of thing, having going on a trip to urgent care to rule out any big things is really important. But just taking that time to like give your body the rest that it needs, like rest when your body tells you to. And then again, gentle movement, not running a 5K, but just at least, going for a walk around the block or something, just getting that blood flow, super critical to faster brain and mental health recovery.
Okay.
We used to be like, sit in a dark room for as long as it takes. And that just led to lots of depression. And we don't, as we know, these things are comorbid. They feed each other. And so we want to make sure to, address that as soon as we can. And then certainly if your trajectory is just getting better and better with that, resting and gentle movement in the first week or so, then fantastic. But if you are not, then we need to be seeking treatment right away.
Okay. That's going to be a lot better for the trajectory of the recovery to seek the help early than to wait.
Absolutely. 100%. And if I'm going to say that if someone is experiencing vision issues like the ones that I mentioned, then seeing a doctor who has experience in neurovisual rehabilitation is critical because the challenge is that not every eye doctor actually looks for how the eyes move and how the eyes work together. So they will often look at how's the health of this eye and how's the vision in this eye and that eye.
Mhm.
And you can pass all of those things easily with a terrible concussion.
Mhm.
And yet your visual system is not okay. So seeing somebody who's actually looking deeper at how, not the structures, but the function, how the eyes and brain are talking to each other, is really critical.
Right. That's why we're doing this, right?
Yes.
Definitely. Do you have any recommendations for prevention?
Let's see. So, we talk about helmets with the sports that prevents your skull from cracking, but it does not prevent your brain from slushing around inside your skull. Um, so, honestly, one of the biggest preventions we can do is is vision therapy, which is crazy. But when we actually like learn how to use our visual system and be more aware of the space around us, then we are much less likely to put ourselves in a position where we smack our head on things.
Okay.
Um, and yes. So in my own case, I know it sounds almost like I don't know, hypocritical because I've had a couple brain injuries. And yes, the first I was like, I have a lot of hair. I was leaning down. I just didn't. It was a brand new plate park. Okay, those are excuses. But the second brain injury was in a vehicle in Uganda in a bus, and the roads were so bumpy, and I was launched from my. It was in a van, but still, it was launched from my seat, and I hit the top of my head again, same place as before, on the roof of the car. Um, so that one wasn't because I wasn't paying attention to my surroundings.
Right.
It was out of my hands.
Yeah.
And I think too because I hit the exact same location as prior, my
Mhm.
brain was like, "Oh, I know what to do. We got this. We'll go back into concussion land." And so, but so in terms of prevention, yes, like just having that, just the better peripheral, like side vision awareness of your space and where you are, is that prevents concussion more than just about anything else.
Nice. Okay. So better peripheral awareness, better awareness of yourself in space,
Correct.
right? Okay.
Yeah. Where am I and where are the things around me?
Yeah, that's awesome. Are there things people can do on their own outside of vision therapy to increase their peripheral awareness?
Um, Typically the more like worked up we are, the more our brain is going to just naturally fall into tunnel vision land.
Mm.
So like the more stressed and anxious and, busy, 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 we're gonna, kind of like bring our vision in and be kind of working on one thing at a time. So taking those moments to take care of yourself, and breathing and not just like breathing, but like actual like deeper breathing. Just really helpful to just get that nervous system in a better place where your brain can be more aware of your surroundings.
Nice. Well, and I like the fact that for people who are into some of those more extreme sports, that there's sports vision
Right.
training that will address those kinds of things too for the different uh, challenging sports that are out there that people like to take part in that may injure their brains, right?
Exactly. And that's where the studies that's what the studies were looking at when it shows that there's fewer brain injuries in the vision therapy population. It's in patients that have done sports vision. So they're looking at a group of athletes and which athletes are more um, inclined or less inclined to have concussion.
Okay, nice. Do you have some resources you'd like to share?
Oh, of course, I'd love to. So first and foremost, if someone has had a brain injury or knows someone or loves someone that has some of the symptoms that I mentioned before, and then finding that eye doctor that can take care of them is really important. There's a couple of websites that we can go to find a doctor that does specialize in this area. And so one website is covd.org. And so that's the College of Optometrists and Vision Development, which has changed its name, but not the website yet. Um, so that's a little confusing, but that's okay.
Yeah.
They are now the Optometric Vision Development and Rehabilitation Association, which is great because it's really speaking to that rehab process that a lot of us do. And then another organization is NORA, the Neuro-Optometric Rehabilitation Association. And that website is noravision.org. I think it's .org. Um, if people want to learn more just about my office and what we do, and we have information on our website, insightvisiontherapy.com. So we've got information on concussion, brain injury, rehab as well.
Okay, awesome. Any last words of advice?
Just take care of yourself and trust your gut. I think that's really important because there's a lot of people that go to physicians and they are told you're fine. or you don't need to do anything. And if that just doesn't sit right with you, then keep on digging because your body knows. It knows what it needs, and it's important to just follow that.
Yeah. That's one of the things that comes up a lot of times when I'm talking to my guests is that we have to be our own best advocate.
Right.
And it's so important to find the help that we need wherever that might be. And it might be something that looks a little less conventional.
Right. Right. Yeah. And I mean, we might practice a large population of patients that we see are kids with learning issues, and that too. It's my little mantra is trust your mom gut, because a lot of times too, the parents are like told, well, they're fine or they're okay or they're within this range, and but your kid, and you know what they're capable of. You know them better than anybody else.
Mhm.
And in that regard, when it comes to brain injury, you know your body. And if you feel like there's someone else in charge of your own body, then something's not okay and needs to be taken care of.
Exactly. Great. Well, thank you so much for all those words of wisdom today. I think this is going to be a great episode for people.
Thank you so
And
much for having me.
yeah, appreciate your taking your time out for us today. Thank you for listening to the Healing Our Sight podcast. I'd love to hear from you. Please share and also join our Facebook community at Healing Our Sight to leave suggestions or comments. Have a great day.